This pilot affecting the prescriptions is very important on two aspects. Initially, it's safety of the patient, so that they're not being given in error or collecting in error any medications that they shouldn't have. The byproduct of that will also then be that it will release funding because there'll be less waste. That funding can then be used to provide more patient care.
I'm supporting this pilot because safety issues. I want everybody to be able to be taking the correct drugs for the right reasons, because I know some of the drugs that's hanging around in people's home are not safe. And all those drugs out there that are being wasted, being thrown away unnecessarily, it's criminal.
It is easy for the pharmacy to collect and order patients' prescriptions, but it's not always safe. It's not always the best option. It may seem easy, but that can lead to a lot of errors, a lot of wrong medications being given, because there is a time lapse between the chemist having the patient's permission to submit the prescription request and that prescription becoming due. That isn't always reflected when the pharmacy collects the prescription.
The change will come in from the 1st of September and patients will order their medicines directly rather than via the pharmacy. We have a large number of the population that order for themselves anyway, so this doesn't apply to the whole population on repeat medication.
From the 1st of September, indeed from now, patients can register in a number of ways to order their prescriptions at their surgery. There is the electronic method, which allows the patient to dial straight into the computer system at the surgery, see their list of medication and ask for the ones that they are due. But we realise the electronic doesn't suit everybody. So we've got old school. There is also the tear off slip, which is the right hand side of your prescription.
We've written out to every patient on repeat medication, and what we'd ask is for patients, if they're concerned, or family members if they're concerned about an individual, to contact their practice and let them know.
For this very important and vulnerable group of patients who sometimes have carers but often have no close family, I would say the practices will be contacting you. We'll be trying to make sure that our systems link into how your life is and how your support is, but there is no problem with you contacting the practice and having that one-to-one discussion over your specific needs and your specific situation. If you've got any concerns, if this is something you've never done before and you just want a little bit of further information, ring your practice. They're not going to have any problems with you making contact. The important thing is that we get it right for you as soon as we can.